Well, it's interesting you asked that because I never was gung-ho to be a doctor to save the world when I was young. I went into medicine because I knew I could always get a job. And I sort of floundered around in medicine and was trying to think what I wanted to do. And then I realized that I really liked obstetrics and didn't like gynecology. And I figured, what do I like about obstetrics? And it was bringing happiness to people. And then it's sort of something, a light bulb went off in my mind, and I said, ophthalmology, you bring happiness to people, you give them sight. And when I went into ophthalmology, I loved it and have been thrilled doing what I'm doing for the past 30 plus years. I chose cornea for several reasons, but I jokingly tell the residents that when I was a second-year resident back in the days in Toronto, I'm from Canada and did all my pre-fellowship training in Canada and came to Wills to do cornea. We used to have to do tangent screen visual fields on all our private attending glaucoma patients, and it was very frustrating. And I jokingly say, well, you can't map a visual field defect from a corneal scar, so that's why I jokingly say I went into cornea. But I had a very flamboyant, energetic young attending who was a cornea specialist who had just come back from his fellowship, who made a tremendous impact on me and got me interested in it. I liked the aspect of medical, external disease, and the surgical aspect as well. Well, my major area of interest in cornea is corneal transplantation, and for the first 25 years of my practice, it was basically the same type of corneal transplant, full thickness penetrating keratoplasty, we call it, with a little modifications now and then. But then over the past 10 years, there's been a resurgence of lamellar corneal transplants, which really stimulated my interest and sort of rejuvenated me from doing the same old things. And I've really enjoyed the past 10, 12 years of doing those newer procedures. Well, Wills Eye Hospital is world-renowned. Actually, when I came here to do my cornea fellowship, it wasn't so much for Wills Eye Hospital. It was mostly because of the person involved here. It was Peter Leipzin, who was my mentor for many years. Juan Aronson also was a mentor. He was Dr. Leibzin's junior partner. But once I came here at Wills and saw how wonderful and magnificent it was, world-class, everything, and you could bounce ideas off any world expert in any field of ophthalmology, it really hit home of what a great, fantastic place this is and how Philadelphia is lucky to have it. My spare time, I like to do a lot of physical things. I spend a lot of time at my desk reading, writing, doing things like that. So when I have some free time, I like to run, I like to play tennis. Now I have a 2-year-old grandson, so he keeps me running and busy. I like to travel. I like art. I like going to museums. So I have a lot to keep me going in my spare time.